Hello and welcome to WP. Well, he's the McGowan government's go-to man for all things health-related in WA. Health Minister Roger Cook has been front and centre during COVID-19, helping navigate WA through the pandemic with Premier Mark McGowan. We talked to Roger about how he saw WA this year health-wise and what he hopes for the state in 2021.
2020 is like nothing we have ever experienced before. COVID-19 has certainly tested the mechanism of government and the economy, local businesses and citizens out there. Are you glad this year is almost over?
Well, obviously it's been a very difficult year. It's been a tough year, not just for government, but for everyone in Western Australia. We're really proud with the way the government has responded. The Premier and I are advised by incredible people, experts in their field, people who are dedicated to great public service to the people of Western Australia, and that's enabled us to make well-informed decisions. So this has been a difficult year, but it's one I think we'll look back on and be very proud of the response, not only from people inside government, but from the community generally.
When it comes to government response, what can be improved in your opinion?
Well, we could always improve, and we never rest on our laurels when it comes to our response to COVID-19. We look to the experiences both overseas and in other states to see how we can continue to improve the way we respond to COVID-19. And in fact, we have a team inside the WA government dedicated to continuous review and assessment of all our processes to make sure that we're making changes where we need to.
We all know that young people have took a huge hit economically as a result of the virus. What do you make of the overall response, and were they resilient enough during the crisis?
Look, I've been amazed with the resilience of young people. Just this week I've had the opportunity to attend a number of school graduations where kids have had, like no other year, have had their year interrupted, their schooling and their education as a result of COVID-19. And look, I just think they've done an outstanding job. Obviously, young people in the workplace is an area of great concern for the McGowan government. We want to get young people back into jobs to make sure that they can play their part in our growing economy. And that's a real focus for us, particularly around training.
According to the AMA, they are still putting forward many concerns over PPE for frontline health workers and I suppose our overall preparedness for COVID. How prepared are we as a state? Are we really not that prepared to stay safe?
No, in relation to PPE, we have a great supply of personal protection equipment for all our staff so that they can keep their patients safe and they can keep themselves safe. The issues with regards to the AMA go more to the question of what's called fit testing, which is ensuring that each member of our healthcare workforce have the opportunity to be trained around specific equipment, have that fit that they've got around the PPE tested to make sure that we've got the appropriate level of quality guarantee available. And we'll continue to work with all healthcare workers to ensure they get that testing and get the equipment they need.
Looking back, what's the hardest decision you have to make this year as Minister?
Well, look, it's obviously the Premier and I were making decisions to close down whole industries. People were being put out of work. People had their livelihoods stolen by COVID-19. They were some really difficult decisions. And so one of the really great aspects of this is that we've been able to allow people to come back into the workplace to get businesses back on their feet. But there was no doubt it was really tough to make sure in terms of making decisions which we knew meant that many people would lose their jobs and their livelihood.
With the election coming early next year and based on the public's approval rating on your government's approach, are you confident winning?
Look, we never take anything for granted. We have to seek the support of the WA public by putting our policies and our record on the table so that they can make a proper assessment about who should lead this state going forward. But we are confident that the leadership that the Premier, Mark McGowan, has provided the WA community, both in 2020 but throughout our first term, that the people of Western Australia will acknowledge that he's done an amazing job. But we don't take it for granted, and we're going to be make sure that we run a proper campaign to see if we can get the endorsement of the WA people for another term.
Do you have any regrets, and what are your hopes for 2021?
Well, look, my hope for 2021 is that it's happy and it's safe. We've obviously got a big task now of, once we've received the vaccine, getting that vaccine out to as many people as possible. This is a great milestone in terms of our fight around COVID-19, and we'll continue to try and make all those decisions which are in the interests of keeping Western Australians safe.
Minister, thanks for your time. Merry Christmas and Happy New Year to you.
Well, look, thank you, Ivan, and to all your viewers. I hope everyone has a great festive season and a great, happy and a safe New Year.
And now, here's AMA WA President Dr Andrew Miller with your COVID-19 update and commentary.
Thanks for your time in the week before Christmas 2020, a time when people will of course be getting together. December 25, December 31, two of the biggest gathering days of the year, two of the biggest days for spreading virus, and that's not a big drama if you're living in a community where there is no virus, but obviously now we're dealing with an uncontrolled outbreak in New South Wales. Why do I say it's uncontrolled? Well, because we don't know how it got from the hotels, which is where it must have come from, to the northern beaches of Sydney at the moment. So along the way there, we don't know how many branches there are of this particular tree of the virus. So it's unclear exactly how many cases there are out there in the community, although they're finding around 60 so far. There may be many more that are travelling along without symptoms, because half of the people who have the disease will have no symptoms. They'll be highly infectious and spread it within 48 hours to 72 hours from the time that they get the infection themselves. And that's where the urgency comes from in this disease. It doesn't give you any let up. It's not interested in our festivals. It just wants to go from person to person. Within 24, 48 hours, it'll start to become infective. That's why contact tracing has to work that quickly. That's why it's really important in Western Australia that we get used to using the QR codes properly. Everywhere we go, there should be just one app. It should be mandated, the Safe WA app, and it should be mandated for everywhere that people gather together. Likewise, we should have masks available for the public to wear, and as soon as there's any sort of outbreak, that should be mandated as well. Unfortunately, in New South Wales, they're pussyfooting around with this. They're kind of, saying, well, we'll reduce things a bit here and there, and maybe in one area we'll shut down the gatherings, but we know full well that COVID is no respecter of postcodes. They tried this in Victoria before, didn't work. I wish them all the best in New South Wales. I really hope they can bring it under control this way, but it's not the most precautionary way of going after it. And we know with pandemic, with COVID, precautionary is the only way to go, and that's why we commend the West Australian government for going ahead and making it much less traffic coming into the state, and for keeping our air crews in hotel quarantine. What could we be doing better? Well, we could stop having people coming and going from hotel quarantine who shouldn't be there. So other guests that are not quarantined are still being accommodated in quarantine hotels. We've got lots of workers going there who are not being tested because they're not either security guards or cleaners. And we have way too much in the way of people working other jobs at the same time as working in hotels. These are all things that we know are vulnerabilities, all very clear. That there is airborne spread of this disease. You can get it from a lift when there's no one in there. If they just got out and they'd been coughing or talking before you got in, the doors open up, in you get. We all know that you can smell things that have been left in the lift before we get there, such as cigarette smoke, and that's how this virus travels around. So we can either get serious about this, or we can deal with repeated episodes of disruption to people's travel arrangements and lives over the next 12 months or so until we get an effective vaccine rolled out through the community. I think our leaders need to be front and centre explaining to us why they're not doing everything they possibly can, and they're not doing everything they possibly can, and why they're not encouraging people to be buying masks at the moment, putting them aside for that rainy day that hopefully we won't need them. But if suddenly we all do need to wear a mask, as they should be doing, but they're not yet doing in Sydney, then where are we going to get them from? We're going to have a sudden panic, people running around buying toilet paper and surgical masks next time. Anyway, you might detect a tone of frustration in my voice, but it's December now. Christmas is upon us, and we've been going on about this since February. So time to finish off these preparations, get sewage testing in place. That's how they picked it up in Sydney. I don't think we have that capacity here in Western Australia to say what areas do and don't have COVID in the sewage water at the moment. I certainly haven't seen any report on it. I don't know if you have. We need to get our homework done because unfortunately not only is it more likely that we're going to get an outbreak the longer things go on, this is the peak time of the year. This is when everyone gets together. On that note, thank you to those people who have been inconvenienced, who are doing it tough in quarantine. Really appreciate what you're doing. We don't underestimate your sacrifice, and we hope that it will be made worthwhile for you by seeing no disease at all in the West Australian community. Not only because we don't want people to get sick and die from it, and we don't want lockdowns, but also we don't know the long-term effects of the disease. Even mild disease seems to be causing some problems for some people in the long term. So have a safe week. We'll talk to you again before Christmas sometime. And at this time of the year, more than any other, let's think of others, put them first, and be safe. Thank you.
And that's WP this Sunday. Be watching on Wednesday as we bring you the final Western perspective for the year. But for now, it's back to you.
Thank you, Nelson. And that's our weekly news and current affairs. We have the latest news on our website and social media pages.
Don't forget to join us next Wednesday for our final bulletin for 2020. Until then, from Sarah and myself, we wish you good health and good night.
Take care.